We're going to go on now and look at the treatment of hypoxia, and in a minute I want to talk about assessment. But before we do assessment, I want to give you a couple of absolutely fundamental principles, because we could faff on for quite a while assessing patients while they're becoming progressively hypoxic. So if you're worried that a patient may be becoming hypoxic, the rule is A and B and oxygen first. A, airway, get the airway clear. B, make sure they're breathing, then give them oxygen. So remember that, A and B and oxygen first, A and B and oxygen first. Clear the airway, get them breathing, get some oxygen in, then you can do a more detailed assessment after that. And as a rule of thumb, it's probably fair to say that most patients need supplemental oxygen, additional oxygen, when their oxygen saturations drop to 92% or below. Assessment of the hypoxic patient. How are we going to recognise that a patient is hypoxic? Well, oxygen levels have been described as the fifth vital sign. Temperature, pulse, respiration, blood pressure, oxygen saturations. SpO2s, the SaO2 as measured in the periphery, in the fingers or the toes or even the ears. We need to know what the patient's oxygen saturations are, because new research is showing that if the oxygen saturations drop by as little as 3%, that is clinically significant. Now, of course, normally when the patient's oxygen saturations drop, the probe is dirty and it needs cleaned. But providing you're doing it properly, a drop in as little as 3% in the levels of a patient's oxygenation are clinically significant and are probably the first sign of a deteriorating situation or the onset of an acute illness. So we need to monitor the saturations and take a drop of 3% seriously. A drop of 3% in oxygen saturations should be explained, may indicate the patient is about to deteriorate. O2 sats, the fifth vital sign. Rate and depth of respirations, of course, we monitor those. Mental state, Glasgow Coma Scale, pallor, has the patient become pale? Are they cyanosed? Has the heart rate increased? Has the blood pressure increased? If blood gases are available, has the PO2 dropped? In the longer term, has the amount of red cells increased? Is there an increased packed cell volume, indicating a polycythemic response? And personally, any patient that is hypoxic, I like to have them on an ECG monitor because I can see what effect any hypoxia might be having on essential cardiac physiology.